All right, so I wanted to respond to this comment in particular because there are a couple things to clarify. So first off, they mentioned elective as not being covered by insurance. Elective just means it's a scheduled procedure. It's not an emergency. So most surgical procedures are in fact elective. Hernia repairs are elective. Gallbladders can be elective or they can be emergent. Appendectomy is usually emergent. Breast reduction or mastectomy, that's going to be elective. So anything that's not emergent is elective. Elective is different than considered medically necessary by insurance. So insurance always considers emergency surgery medically necessary, but elective cases may or may not be covered by insurance. So breast reduction might be covered by insurance, breast augmentation never is. Now in my particular case, I only do elective procedures. I also only do cosmetic procedures, so I don't take insurance. The one time that might not apply is breast reduction. Insurance does sometimes consider that medically necessary. Now, I don't work with insurance companies because they're just absolutely maddening and impossible to work with. So my patients do pay ahead of time for the procedure. Now, if they think they might be covered under insurance, the one example is generally breast reduction because that's the only procedure I do that insurance does sometimes cover. I will give them the info they need in terms of the procedure codes, the diagnosis codes, their pictures, their notes to submit to insurance to try to get paid, in which case the patient pays me, insurance reimburses them later. Out of the patients I've had do that, I think maybe 2 have been successful and once it took like a year. Insurance is terrible to work with intentionally, which is why I don't work with them. But if a patient wants to submit their own stuff, I'll at least give them the information. So that's the difference between medically necessary versus cosmetic and elective versus emergent.